You think hospitals are the same everywhere? Think again. The hospital you'd be taken to in an emergency could mean the difference between world-class care and a death sentence, and it has nothing to do with the skills of doctors. What you're about to discover will shatter everything you believed about healthcare quality, access, and what really determines whether you live or die when you need help most. American hospitals, the most expensive failure. American hospitals are the most expensive in the world, yet they rank 37th globally in overall healthcare outcomes. A single night in a U.S. hospital averages $5,220. An appendectomy that costs $3,000 in Spain will run you $33,000 in America for the exact same procedure. But here's what nobody tells you. The price has nothing to do with quality. American hospitals operate on a profit maximization model. Every test, every scan, every medication is a revenue opportunity. You're not a patient, you're a profit center. The American system excels at one thing: emergency trauma care. If you're in a severe accident, you want to be near an American trauma center. But for everything else, routine surgery, chronic disease management, preventive care, you're paying premium prices for mediocre outcomes. Insurance companies control what treatments doctors can provide. Your physician might know exactly what you need, but an accountant in a cubicle decides whether you get it. Prior authorizations delay care, sometimes fatally. The system prioritizes profit over patients, and the results are devastating. Medical errors are the third leading cause of death in America, killing over 250,000 people annually. That's more than respiratory disease, more than accidents, more than Alzheimer's. Most of these deaths are preventable, but the system isn't designed to prevent them. It's designed to generate revenue. Japanese hospitals. Efficiency meets excellence. Japan has the highest number of hospital beds per capita and some of the shortest wait times in the developed world. Walk into a Japanese hospital and you'll experience something Americans can barely imagine: immediate attention, thorough care, and a bill that won't bankrupt you. A typical hospital stay in Japan costs about $3,500 per day, expensive by global standards, but including everything: medication, food, nursing care, doctor visits, no hidden fees, no surprise bills months later. The total transparency is revolutionary compared to American healthcare billing chaos. Japanese hospitals emphasize prevention and early intervention. Regular health screenings are standard, covered by national insurance, and aggressively promoted. The result? Japan has one of the highest life expectancies globally and the lowest infant mortality rate. But Japan's system has challenges. Doctors work brutal hours, often 80 to 100 hours weekly. The culture of overwork that plagues Japanese society extends to healthcare workers. Burnout is epidemic, yet the system keeps functioning because cultural values prioritize duty over individual well-being. Hospital stays in Japan are also unusually long. What would be outpatient surgery in America often requires multi-day hospitalization in Japan. This isn't just caution, it's cultural expectation and insurance structure incentivizing longer stays. Scandinavian hospitals, the social medicine model. Norway, Sweden, and Denmark provide universal healthcare funded by high taxes, and their hospital outcomes are consistently ranked among the world's best. There are no medical bankruptcies because there are no medical bills. Healthcare is a right, not a commodity. Walk into a Swedish hospital with a broken leg and you'll pay a maximum of about $30 for the entire treatment. Surgery, hospital stay, medications, follow-up, everything. The system is designed around patient outcomes, not profit margins. Wait times can be longer for non-urgent procedures. Need a knee replacement? You might wait months, but if you have cancer or heart disease, you're fast-tracked immediately. The system prioritizes medical urgency, not ability to pay. Scandinavian hospitals invest heavily in preventive care and public health. They'd rather spend money keeping you healthy than treating you when you're sick. This approach costs less and produces better outcomes, a concept that seems revolutionary to Americans but is common sense everywhere else. The doctor-patient relationship is fundamentally different. Appointments last 30 to 45 minutes, not 7. Physicians have time to investigate root causes rather than just matching symptoms to prescriptions. If you're starting to see how broken some systems really are, hit that subscribe button. We're exposing the global healthcare reality they don't want you to see. and you need to understand what's really happening worldwide. Indian hospitals, the extreme divide. India has some of the world's best private hospitals and some of the world's worst public ones. The gap between them is staggering and reveals the brutal reality of healthcare inequality. Private hospitals in major Indian cities like Apollo or Fortis offer world-class care at a fraction of Western costs. A heart bypass surgery costing $150,000 in America runs about $10,000 in India with comparable or better outcomes. Medical tourism to India is a billion-dollar industry for good reason. These hospitals have cutting-edge technology, internationally trained surgeons, and luxury amenities that rival five-star hotels. For those who can afford it, Indian private healthcare is exceptional value. But public hospitals tell a different story. Overcrowding is so severe that patients share beds or sleep on floors. One doctor might see 200 patients daily. Equipment is outdated or broken. Basic supplies run out regularly. The care gap between rich and poor is a chasm. Rural India faces even worse conditions. Villages lack basic medical facilities. Childbirth complications that would be routine in cities become death sentences. Geographic inequality in healthcare access is extreme, yet India is innovating in healthcare delivery. Telemedicine connects rural patients to urban specialists. Low-cost medical devices designed for resource-poor settings are revolutionizing care. Necessity breeds innovation, and India is proving you don't need massive budgets for significant health improvements. Cuban hospitals, healthcare under embargo. Cuba has a higher life expectancy than the United States, despite spending 20 times less per capita on healthcare. This paradox has puzzled healthcare economists for decades. Cuban hospitals operate under severe resource constraints due to the U.S. embargo. They lack advanced equipment, medications are often unavailable, and facilities are dated. Yet somehow, health outcomes rival or exceed wealthy nations. The secret is prevention and primary care. Cuba has more doctors per capita than almost any country, and they focus on keeping people healthy rather than treating sickness. Family doctors know their patients intimately because they live in the same neighborhoods. Medical education is free, and doctors are expected to serve their communities. The doctor-patient ratio allows for preventive care that would be impossible in profit-driven systems. When you can't afford expensive treatments, you invest in preventing disease, and it works. But the system has serious limitations. Complex surgeries or advanced cancer treatments that are routine elsewhere are often unavailable. Cubans with means seek care abroad when possible. Preventive excellence can't overcome resource scarcity for acute interventions. The Cuban model proves that money isn't everything in healthcare, but it also shows that money matters when you need advanced interventions. It's a study in trade-offs. German hospitals, the balanced approach. Germany combines universal coverage with private insurance options, creating a hybrid system that avoids the extremes of pure capitalism or pure socialism. Everyone must have insurance, but you choose between public and private plans. German hospitals are well-funded, thoroughly staffed, and technologically advanced. Quality is consistently high whether you're in Berlin or a small town. Wait times are reasonable, outcomes are excellent, and nobody goes bankrupt from medical bills. The system allows competition while ensuring universal access. Private insurance offers perks like private rooms and shorter waits, but public insurance provides comprehensive care. The safety net is strong, yet innovation is encouraged. German doctors are well compensated but not exorbitantly so. The focus is on medicine as a profession rather than a business. Hospital administrators are often physicians who understand patient care, not just MBAs focused on profit margins. If you're realizing your healthcare system might not be as good as you thought, subscribe now. We're breaking down global systems every week so you can see what's possible and demand better. The shocking truth about hospitals worldwide is this: quality healthcare doesn't require astronomical spending. The best systems prioritize prevention, invest in primary care, and treat medicine as a public good rather than a profit opportunity. America spends the most and gets less because the system is designed to extract wealth, not promote health. Understanding how other countries deliver better care for less should make you angry and motivated to demand change.